Hold on, I'm still get out the mode. Okay. So okay. So our medical mission, as you know, is we are always patient center. One of the main goal is to treat patient like a family. So everything we build our program is based on the needs of the patients. And also our medical mission is during the outreach is to learn to be better ourselves. Like I always say, our medical outreach or mobile clinic event is a platform for us to be learn, to be humble, to be better, to be service other people. Is our learning environment for us to be a better Tzu Chi person. Okay, and also introduce a platform to introduce a mainstream to our partner who we are through medical mission. Through medical mission, we can reach out a lot of partners, a lot of community volunteers, and also patients that no idea who Tzu Chi is. And that's a good platform to reach out to them. And of course, mainly is invite them to join our Tzu Chi path, our Bodhisattva path. See? So it's all these things have to be come from teamwork. See, it's a teamwork. And so far, mobile clinic have all these. We have 10 mobile clinics, and 1 is in San Jose, 4 in Fresno, 3 in South Monte, which is in LA, and 2 is in New York. So San Jose is a dental mobile. Fresno have 2 dental mobile, 1 medical and 1 vision. LA 1 medical, 1 dental, and 1 vision. And New York has 1 vision exam and 1 optical exam, optical lab mobile. Those are the mobiles currently we have, and we know that other locations several TIMA team expressing interest of having building a mobile in their region. We are happy to help. You can reach out to us and we can start give you some guideline and see what need to be prepared to have a mobile. Okay. Next is the difference between mobile clinic and outreach. Both are malpractice insurance. Like always have a question about is who protect the doctors. We cover, Medical Foundation cover the malpractice insurance for all the activities, medical activity in United States. So either mobile or outreach, all the provider working on that day will be covered under our malpractice insurance, which is the Medical Foundations. Okay. Then the difference between mobile clinic and outreach is mobile is create program and provide continued care. Outreach is create event by event. And also, mobiles usually are not suitable for health fair environment. Because of health fair, usually a lot of people come into the event and mobile cannot treat them. So it's usually are not visible to reach out to outreach the health fair environment due to the cost of operation, all those things. Also, mostly and slowly will be all the mobile clinic event are by appointment only. All but we set up by appointment. Majority now, all the mobiles running now is by appointments. No walk-ins eventually. And also all the manpower are supported by local TIMAs member, local Tzu Chi volunteers, and mobile volunteers and mobile staff and community volunteers. And compared to outreach, in outreach setting, they offer medical, dental, vision, and chiropractor all and acupuncture all in one roof, in 1 day or 2 days. And all these are walking type, but both mobile and outreach supported manpower are from the same resource, local TIMA, local volunteers, and community volunteers. Okay, and one thing is mobile clinic is easy to reach out to a rural area and fastest time to set up. Initial costs are high, but operation cost eventually is lower compared to fixed location. And also branding, easy to create marketing tool for branding, and also potential apply grants to support the program, because grants usually will provide to organizations have program, not have events, you see. So outreach is usually urban, suburban, more equipment and longer time to set up. The costs are only the equipment maybe earlier expensive. Other than that, the cost is pretty much very low. Branding wise, you still can do a lot of branding if you set up the environments with a wow experience and really organize, really impress people. Those branding, you will still can get some grant out there. And apply grant is if they meet the assessment of requirement by the grantor that will impact the committee. A lot of grantors will give outreach too. It all depends on how we can reach out those money. Mobile clinic usually need about 8 parking space with 2 tents and 2 tables and 10 chairs. Pretty much you can set up the mobile clinic. And a mature mobile team usually will continue to increase their fleets to getting more, able to find more money to buy more mobiles in their fleets, and also create more programs to serve the population they are serving in their territories. Compared to outreach, outreach usually take minimum 5,000 square feet size. Usually below 5,000 square feet size are not suitable for mobile ones, because the space with the number of people in there you end up is congested, and people feel very pushed to a small 1 square boxes with limited of space, personal space. So I always encourage all the team to have minimum of 5,000 to 7,000 square feet to do an outreach to make it look glamour, more humanistic of Tzu Chi. You're able to present with this kind of location, see? And usually it will take 20, 40 tables and 150 to 200 chairs. All depends on what kind of services you put in under that outreach. If the more services, you may end up with 500 to 1,000. Some of the event I've been set up that we do about 1,000 chairs with 300 tables in there. So those are the things that you can make the experience change for patient, for provider and volunteer. Look at what the difference of Tzu Chi outreach and Tzu Chi non-Tzu Chi outreach. And a mature medical team also will start usually looking forward to buy established mobile clinic. So that means that when the mature teams that have done enough outreach, done enough all these things, they usually are more comfortable to have a mobile clinic or fixed location, okay? And committed team will build strong lead. A community team will build strong event, lead to continued care, which is you will extend from every month or every 3 months clinic. You may end up with every month. You will have a smaller event for the patient who used to go to 3 months, every 3 months on your location, to have a continued care to be every month now. So all those things are built up from a teamwork that are building set up, okay? So I know 2020 is a pandemic. Everyone's been slowed down and shut down operations. And so the best comparison is I started with 2019 on the overall, the mobile. This is just mobile, not outreach, okay? This is just mobile clinic. We have Fresno Mobile, Southern California, which is LA, Northern California, San Jose, and New York mobile. So total of 2019, we do 236 outreach and serving 4,900 patients with 11,000 encounter service. That means a multiple service each patient get. But 2020, we slowed down. Some of the area been shut down, and pretty much we only able to do 61 events with 1,300 patients and 2,600 service encounter. But since January 2021, this year, once most of the team get vaccinated, we back to normal, quite to normal. And now we, I think, starting this month, we're all pretty much back to normal of the operations. So you see the number will be start popping up, like total now is 87 events, 4,000 students, 4,000 patients, and 5,000 service encounter. Okay, so those are the mobile clinic activities. And in terms of professional use, you can see 2019 we used 824 doctors to provide all these services the whole year. And labor hour is eventually is what call it 11,000 labor hour. Non-profession wise is 1,300 for 2019. In 2021 now we have reached so far 309 professional, and non-professional is 708, and volunteer hours is contribute about 5,031 hours so far in this event for this year. So COVID are the one that we slow down, but we never stop. So mobile clinic usually operate with a limited of staff, but with the help of big group of more volunteer, like Fresno, San Jose, New York do have a lot of volunteers. Same thing as Los Angeles. 4-in-1 structure in Los Angeles do come up to help on the mobile clinic in LA. And LA Mobile currently is in scope with FQSC lookalike, which means that it's part of the FQSC. So it will be start working mainly with staff operations because of the business, the structure of FQSC. So we'll provide free services, mobile clinic, and charging insurance if the mobile still is in scope with the FQSC lookalike. So when certain event, like for example, LA, certain event we go is a FQSC clinic, then we charge the insurance. If no insurance, we still see them for free. But if let's say we support LA, some of the outreach program, that is not an FQSC function that day. So it's a charitable clinic for us on that day. So everything will be free. So regardless of everything, is either we still provide services, either we charge it or we do it for free. Okay. So Tzu Chi Medical usually have we create a platform. A platform, medical platform is usually give opportunity people to work with the local community partners, and also to build a brand name in the community, opportunity to build a strong medical team, and also to build a strong volunteer groups, opportunity to provide quality care for patients. And to enable you to have a strong team to create a program, you have a self-sustain and able to self-sustain a grant in the mobile and outreach with this platform that you try to build a team. Okay. Somehow I'm not sure why my PowerPoint not working. Okay. And the opportunity to work with the community partners, usually school, non-profit organization, healthcare community, healthcare partner companies and government agency, and usually develop program or let them be part of the community health initiative. And whenever we join those programs or be part of the health initiative, usually they follow with a grant opportunity to support those activities for Tzu Chi. Okay. Then the leverage partner is a community partner, usually provide funding, cost, network, and patient. They will look for patient for us, do marketing for us, and even if they are partner, if we are partnering with hospital or any health clinic, they also will provide provider and volunteers too. So all those things are partners, the benefit of partnering with community partners. When the community partner have benefit of partner with us, Tzu Chi, because they can leverage from us is we have equipment, we have a system and platform, and we are do a big pool of our Tzu Chi volunteer trained to be doing outreach, and then end up with we are the anchor of the event. It's the main important things. We run the show of the event. Okay, so that way we can put our Tzu Chi humanistic culture into our outreach, show the mainstream who Tzu Chi is, how we treat patients with respect, all those things, and with a beautiful smile of all these volunteers of Tzu Chi. Then, what partner look for? See, partners usually look for strong program for the community. And I mentioned earlier, we need to start thinking of looking program, not event by event. Opportunity to be part of the community service. Partners looking at that, does the program is part of the community needs. It's belong to the CD, belong to the local community. It's not just belong to Tzu Chi. Those are very important mindset have to be in thinking of doing a program. Then allow to help solve the community needs. You, as we need to know what is our local community needs and what local need. We cannot say that, oh, because of Tzu Chi like to do this part of program, but the community don't need it. And we still enforce it. And usually they end up with nobody will join those programs or will not be successful. Okay. Program only successful when the local community like are involved and the need is there. Okay. And a solid and trustworthy organization like Tzu Chi, people, other partners will always like to participate and be partnered with. So opportunity to build a brand name in our community, create brand name through
I just took a walk.
Create a program that community partner can be participate in volunteering and provide funding to benefit the local. So when they have a see opportunity and brand program is good, they usually will participate and try to help those programs. And must be aware of what your local needs, like I mentioned before. Usually, let's say LA or all the big city or big county, every 2 to 3 years, they have an assessment report of the county or the city run by health department, hospitals, and also the city of your place you live. And those reports will tell from housing, employment, and also for health issue. When I usually look at the health issue side every 3 to 4 years, the new report come out, see what's the need there. Then we create program surrounding that needs to fulfill the gap of the need in the medical care. We also call it access help, you see. And most grantor will be available based on those program needs reports. See, usually they will be grantor will purposely create some funding to cater the needs and let other organizations will come and apply for those based on those reports. So remember that once those assessment reports come out, you look at it, they always come with opportunity monies to apply grant for that. So those are the things like Fresno. Just as you know, some of you know that we just in Fresno celebrate the 20 years, and they already reached this Fresno team reached 1,000 events this year. Due to COVID, if not last year, they already reached their 1,000 events. And it takes a commitment of these volunteers and TIMA volunteers and community partners to pay and join force with the Fresno team to reach these 20 years and serving over 1,000 events. And they create $21 million of market value and volunteer contribution hours to these 20 years to the community of Fresno County. In medical service, dental, eye care, acupunctures, and all kinds of services that they have. But over the years, they build their program. This is their program for everyone reference and what I'm trying to say. Under this platform, they care for Healthy Fresno. They have sister town, Healthy Sister Town for the rural area, Healthy Fresno for the urban area, and senior, we care for the senior program, which is 2017. In Fresno, they say that there's a very niche program, population that senior do not have a proper dental care and vision care. And this program is catered to vision and dental for the senior in Fresno County. And C2 Success, same thing, is catered for pre-K to third grade children eye care in the school in Fresno County. And so Highway 99, we go out all the way to Sacramento, IK20, Smile for You, and our migrant family is the latest migrant program that we started with. We'll work with Fresno County Migrant Program for this program. See?
You know, when I was out at Kerman, and some of the students, I mean, we're talking little kindergarten, first grade, second, and third, and you know, as some were getting dilated, you know, or they were afraid to get that eye drop. They were like, no, crying, and you know, the team was just so passionate and made them feel comfortable to the point where they got their shot, they got their drops, relaxed. They were even, I think, I think it's part of the whole vision process, but it just looked like games because they were saying, can you point here? Can you see this? What is this? You know, glasses with one, you know, so, you know, I was taking pictures of them, and some of them, you know, wearing their one-eyed glasses, and then when they put their vision glasses once they get dilated, you know, students, they were happy. They, you know, as they were going through the process, I love the process that Tzu Chi has. The stations from the beginning to the end. And, you know, seeing the end result of the students, you know, I remember a young student, again, from Kerman. And, you know, there's, towards the end of the stations that Tzu Chi has, there's a display of glasses that students can choose. So students' choice of a pair of glasses, whether it's blue, pink, black, whatever it is, I mean, they're so flexible, bendable. You know, parents were even saying, no, I don't think my kids are ever going to break these glasses. And, you know, seeing that student, you know, come in and say, hey, mister, you know, I can see now. You know, was very touching, because if it weren't for Tzu Chi being at that clinic, being at Kerman, at that site, who knows when that student would have received a pair of glasses? Who knows when that student would have been identified as needing glasses? Because like I said earlier, some parents, it's difficult. They may never come to Fresno. They may only come once in a blue moon. But because of that event and because of that clinic, that student had that opportunity to receive glasses, and the parent was so thankful. And I said, don't thank us, thank the Tzu Chi Clinic and their providers for what they do.
Well, this is the partners talk about our programs. That's why what I mean is we have to create programs that really impact the communities. See? Because of the create program will give opportunity for Tzu Chi. Like, for example, Kaiser donated a brand new dental mobile for the community. These are $650,000 mobiles. That is our number 10 mobiles in our fleet. See? And also the community clinic, community partners will see the work of Tzu Chi. They will help to subsidize the cost of operation to Tzu Chi to help out the operation. Kawiwa continue donate, like this year they donate $100,000 for the C to Success program to help the children with eye care. See? So all these things are important when we create a program. See? And also opportunity to build a strong team is with the more programs serving the community, we need to consider a team that a consistent medical team to support it. So the medical team should have a teamwork mentality, positive thinking, commitments, and mindfulness. And also with a strong SOP to set up the standard and the services to ensure the quality care and ensure the Tzu Chi image. See, positive volunteer environment. We want to make sure we have that kind of positive environment for volunteer, and also have a attitude of our responsibility and can be done attitude. See? And always big dream. I always say we always should have a big dream. Big dream move forward with the hope. When there is a hope. Team stay put when there is a doubt. And the goal is, and our goal must be realistic and simple and achievable and one that can be benefit the community. I continue stress to everybody that everything we do is for the community. Everything is based on their needs and build our program surrounding that. Just like same thing as patient. Our medical mission is patient-centered, you see. And also opportunity to get a strong volunteer group. Usually we try not to beg or spoil people to volunteer as provider or non-provider. People naturally join us due to the respect towards the mission and program. Okay, instead of begging, why don't we inspire them with the mission, provide a strong professional and friendly environment, and experience the joy of giving. Respect towards the medical missions and program, we will gain them. Okay. So let's listen the volunteer that have we able to inspire them.
And I want to say, Tzu Chi has taught me a lot. The one thing that sticks with me is we all have another gear. When you think that you are maxed out, when you think you can't do it anymore, when you think you're just used up, no, we do have another gear. And Tzu Chi helped me find that gear. And with that extra gear, I'm going to contribute everything I am to staying involved with Tzu Chi and moving forward, because where they go and they leave footprints, there's nothing but goodness that remains behind.
When Olivia calls and says, "Can you please?" I try to say yes every time. We've all heard when E.F. Hutton talks, everybody listens. When Olivia or Steve talk, we all listen. So if a friend calls you and says, "Can you?" and you hear the name Tzu Chi in it anywhere, please say yes, because it will change your life and the lives of many other people. Thank you.
So those are the things that are supposed to be, you will have a long life of commitment of this volunteer when they feel inspired. But also same time, we as a professional one side, remember we say 80% are non-professional from in the TIMA and doing outreach on mobile. The non-professional side also need to do the job is to make sure to inspire all these providers that you have a nice place to work with. You have a top of the line of the equipment that you use to make them comfortable to practice what's the best for them to treat patients. So like when we this Healthy Friends event nicely coordinate and people line up in orders, all the table be set up. Those are like nurses come out and say, wow, this is very impressive and clean and neat, not all boxes or laying around all those things. See? All the patients come in will sit down nicely and chair in orders, and it's not nicely labeled so that they don't get lost what to do, where to go, all those things. And the dental chair are nicely lined up in order. See? So provider and patient will look like, wow, this is really nice. See? And same thing, look at it. This is how the waiting room is when they have their, each department have their own waiting room, but this is the main waiting room before they go into each sub, like going medical or dental, acupuncture, pediatric, or vision. Then before they go to those separate. Think of it, you are in the hospital, a big room before you go to the small room in each department, see? So in the smaller places, like smaller team that don't have do big event, when you do a small event, same thing. You do nicely, table, organized, line up, all in order, all those things. And one thing, like I say, community volunteer is very, very important in our system, in doing outreach, okay, or mobile clinic. Our source of community volunteer usually are from college students, high school, community partners, and general volunteers, besides our own Tzu Chi volunteer source. And we also are able to provide internship, mobile clinic projects or outreach. See, so sometimes from this group of volunteers, they end up with a commissioner in training, all these things. Like in this picture you saw on the left corner where the RN wearing a white polo shirts, Susan Chen. She's this year she will be the TIMA commissioner, certified commissioner. See, because of she's first walking to our Healthy Friends in 2016. Was so impressed with her. She was impressed with all the work all these volunteers do and all this. Our mission, Tzu Chi mission, is everything from then onward. She's non-stop, continue volunteer and never fail, not showing up to volunteer. So these are look like when you deal with local community volunteers, those are volunteers, not patients, see? These are local community volunteers. These are the local volunteers in the big event, they line up at 4 o'clock morning because the event starts at 6 o'clock morning to 6 o'clock p.m. They come in at 4 o'clock because we do orientation on the day of the event. So everyone come in early, get used to know where all the things are and the floor mats, all those procedure. Same thing, check in all these volunteers, make sure they sign in all those things. Those are when they don't use computer. Now we use computer to check in all these patients and volunteers to sign out so they can keep track their volunteer certificate and volunteer hour for future use or on the spot. We will when they want a certificate for volunteer for that day, after they clock out, then end of the day, we'll email them the certificate of volunteer to the email, yeah. So we use a lot of interpreter, like some of those area, most of the area do use medical interpreter student to help to interpret. These are medical interpreter student from college and not just regular volunteer who speak Spanish. There's volunteers. and we use volunteer to help out to fill up application, because California more have a Latino, Hispanic, and we do need this local volunteer that can speak the language to help to fill up the application registration form, because we try is as Chinese, sometimes we have to roll the tongue, so the pronunciation is always not the accurate way. So opportunity to provide quality care to patient is continued care, and we create a referral service to specialties and add more services. Like if some team have only do medical, now they decide to add vision or dental or anything. Those are the services when your team continue to grow, your program continue to grow. See, and our team that continue to grow will always every year will have some new program added into their system to ensure the patient have more choice or more services to add into their care. So, I mean, Tzu Chi is almost like a one-stop shop. Every patient comes to us, we usually be able to provide dental care, health, medical care, acupuncture care, vision care, and what did I say? Medical, dental, vision, and acupuncture. Yeah. So, and some do have a mammogram, and also all the lab tests. Lab tests will come back to the team and review all those things. All these things are part of the growing, the medical team grow to continue to provide better care. I remember when I first started 20 years ago when a medical mission in Fresno, we have nothing, pretty much patient come in, see, that's what we have to offer, just consultation. But now they get more service from lab, mammogram, and vision, dental care, everything that we can provide, you offer to the patient their needs. But also same thing, mobile clinic, because of it's part of Medical Foundation, we do have a structure, SOP, standard, all those things. We try to train all the team that need to be trained, deliver the same message, same mission, continue training, continue education, and try to do simplified method to do things. Don't make it so complicated. And we standardize all the procedure and build common mindset. That's very important. Once everyone have a same common mindset, then the medical team can continue to move forward. So we do boot camps in Fresno, 2-day boot camps. Those are boot camps we teach teamwork, mindfulness, commitment, SOP, and about grants, all those things. And the team from the Central Valley and Northern California will come and join the training. And we do teach them how to identify their problem and doing the SWOT analysis, all those things to understand their own program, what's the error, what's the need to be improved, all those things, see? Then also hands-on training on identified tools, dental tools, simplify it so that easy to volunteer to learn and easy for doctor to practice, see? Then also vision on hand, how to do the vision, how to handle the vision equipments, how to doing testing for student, all those things. Then also we do go up to New York to train. This before pandemic is the 5th years. Last 2 years we never unable to do it because of COVID. And I hope next year we start back going annually, 2 days training in New York. Then we do same thing, 2 days, all identical training like in California. Then like San Jose also come on to learn all the EHR training, all the software, data collection for patient chart. Then Las Vegas also start doing all this team building. And with that mindset, they really have their own vision equipment. were able to do vision services in Las Vegas without a vision mobile, except only unable to do make glasses on the spot. That Fresno Vision Mobile will support them with that support their vision, their eye classes. So these are the training that have been provided to them, all the equipment. And they did it one time before COVID. And right away, within 48 hours, we send them back all the prescription with the glasses case and the lens cloth for them to deliver to the patients. So same thing, during certain time, mobile do help the, disaster time. San Jose Dental Mobile go out to the Chico fire to help out all those things. So, and also this, what you see is all this dental service with, I believe those are even the local volunteer dentists able to help along with the Tzu Chi dentist on the mobile. So during COVID time, a lot of people shut down, but the mobile still moving on. So vaccination is one of the things that the mobile clinic can help, but of course, without using the mobile, because of when vaccination need a lot of bigger space, move more people. So we still doing like, it's under mobile clinic, but still do vaccination using outreach format to use it, to operate. So we, Fresno Mobile Clinic do rural area vaccinations and provide school. And now we just committed another 50 event vaccination for school and rural area, starting October to next year, 50 vaccination clinics. Today we are in San Joaquin, agriculture town. Primary is a farm worker and a migrant worker. This program is especially for migrant worker COVID vaccinations. My name is Stephen Voon. I'm the Executive Vice President for the mobile clinic for Tzu Chi Medical Foundation. Early morning, every event I have to go to the centers to get the vaccine. Instead of using a portable cooler, we bought a refrigerator, can plug in the car so to maintain the temperature. Because of the vaccine is very delicate with the temperature issue, and because of the rural area take about 1 hour one way to the location. We are glad that we partner with St. Anna's to make it happen.
We've been partners for a long time, and Tzu Chi has always been the provider who can very quickly mobilize volunteers, nurses, doctors. Today we are in San Joaquin. It's one of the most unincorporated areas in Fresno County. It's got a population of many ag workers. They're in agriculture, people who don't have primary care, and who really can't get out to metropolitan Fresno.
Mi nombre es Ana Mendoza y mi esposo y 6 hijos. El día de hoy estamos aquí y recibimos la vacuna, yo y mi esposo. Aquí vivimos en San Joaquín. Venimos caminando porque mi esposo ya no maneja. Entonces para nosotros es más fácil que esté cerca. Para nosotros fue excelente.
My name is Suzanne, and I'm the lead RN for Tzu Chi. I retired from nursing in 2017, and actually I've been feeling quite guilty that I'm not in the front lines with my buddies who are still there. So on Monday, we went to San Joaquin and we did 275 doses there. And today we're at Easton. It's just on the outskirts of Fresno. And today we have 347 people coming through. The clientele are mostly agricultural workers. They're also underserved out here, so it's great that we're able to travel and come out here and make it more convenient for them to get to us. They don't have to travel as far.
A lot of migrant workers here, they don't have healthcare insurance, and everything that we give today be free, and we don't charge them anything. So everybody have the chance to get a vaccine.
We are committed to do 3 times a week, every week. Hopefully, we can expand using this module of mobile clinic to expand to Los Angeles, Northern California, New York, where we have mobile clinic can pick up the same role with other partners and do the vaccination.
The patients feel like they've won a lottery. They feel like, that there's hope for the future. They feel seeing a light at the end of the tunnel now. They're all very happy to get it.
They are just feeling a little bit more relieved. They walk out of here more confident. So we'll continue to come back until the people don't need us anymore.
I will feel nice that the people that came from far away, because if they were not here, we're never gonna get it. So I'm glad for you guys. Please, people, if you have a chance, if you can guys come and get the vaccine, it will help all of us.
So those are the videos that we just shot this year, what our program is. So we do go out to the factory. Fresno County have a lot of rural area where have factory, or doing garlic, canning, processing, all those pecans, all those things, product. And this is a guest worker from Mexico that arrived, so we help them, vaccinated them as much as we can with vaccine, so that to ensure they are safe, and so to ensure the citizens of Fresno safe with all these guest worker. See, then we do inside and outside. Inside to do vaccination walk-in and pre-appointment, and outside is a drive-through for those people have handicap. We do in all kind of environment. Night, sometimes we have to left over some doses. We have to work late night to make sure finish up all the vaccine. And also we do it in the school, field, and basketball court to enable to cope with all these large group of patients. And also we do home vaccination when we are there. Sometimes some patients are unable to come. We send our provider to go to the house and vaccinate, do the vaccinations. I think part of this is very important, because if we don't do this home visitation vaccination, then they unable to go out to do it. So I'm glad that our team able to do these home vaccinations. And same thing like this one, they come to our site and say that their husband at home cannot come out. The ladies look very healthy. She's 90 years old, husband is 80 plus. And we walk there, some walk a mile from the location to their house to give vaccination. Sometimes for them say, oh, 1 mile is very close. Oh, they say very close, but when we end up with 1 mile, we never thought like, oh, 1 mile, that's in hot heat in summer is very, very difficult. But for them, they used to. For our volunteers, like, it was a big surprise for them. But it's like I say, it's a platform learning. It's a learning of to be better ourselves, to be grateful what we have. And I'm glad that mobile clinic and medical outreach provide this platform for all of us to be grateful and humble and able to provide better service for people who in need. And thank you very much. And hopefully I didn't rush my presentation too fast, and I'm still ahead of a bit time for you guys to catch a break. Thank you very much. So I guess it's going to be lunchtime unless you guys have questions.
Yeah, I do have a question. Can you provide your PPT and also this video presentation for our doctors? Yeah.
Let's see. And you are Jonathan Yang or who?
Okay, and this is Ren from Phoenix.
Oh, Phoenix. Yeah. I can share my PDF file and I send some of the videos in 360. I will try to give you the link later. Yeah, and I know Phoenix, you guys are trying to do medical outreach more, and like I say, Medical Foundation are willing to help as long as you can ask us. We can provide training for you guys. Okay.
Okay, thank you very much.
Stephen, hi Stephen.
Hi, Dr. Cheng.
Yeah, thank you so much for excellent presentation. I have one question. After your mobile clinic or medical outreach, do you have a regular clinic or community clinic in Fresno area to get a regular follow-ups for your all these patients?
We do follow up some of them from outside, refer in the rural area, but in our location, we do have our clinic, Tuesday clinic, to follow up some of the patients regularly for those who need hypertension, medication, diabetes patient, and some other mild medical needs. We do see them in our Tuesday clinic in our location.
Okay, some patients need a specialist or referral service. For example, you found out that heart problem, heart murmur, heart failure, and also like a surgical case, abdominal mass or something. Where do you refer to these cases?
We usually, our doctor will have a list of referral area. We refer to some of the FQSC clinic to follow up, and some of them from there they will join and in the system FQSC from the local in Fresno area. Then they will refer out to their specialties. Like for vision, sometimes we refer, and sometimes we can able to get our partners, some of the big eye institute partner, do some free service for them too. So like our vision program, the See to Success, we've been doing that for since 2016, and we so far only have one cases that need eye surgery. So our partner pick up that patient and provide free surgery for that child. So those are the things. That's why I said we need to build up all this network of refer that we can pass the patient to them, and they will handle it from then onward. But we also have start having, like, once we pass the patient to them, we do follow up with the provider, see did the patient show up with them, and how's everything goes, all those things. Then the provider usually will let us know how's the situation of the patient under their care. So those are the things that every team need to start working on these kind of things so that we can solely comprehensive care for them through us or through partners.
Yeah, how do you look for that kind of referral center? Do they charge money, or do you need to refer to the county hospital or government hospital?
Some will have charged with a minimum. Some do take Medicare, because most of the under Obama affordable care now, most of them have insurance. They will have a program. So a lot of partners have programs that fit into their. Like for example, we just started a mammogram service for free. But technically that partner come into our location for mammogram, but they have a funding from No Woman Left Behind, that grant. So if that patient that we put, they come to our location, we schedule all these women for appointments for that day. I think it's about 25, 26 appointments a day. And if that patient do not have medical, they will be funded by the women's No Women Left Behind grant. If they have medical will pick up that. So eventually that patient get the mammogram service is 100% is free. So those are the things that the team need to know where to look for and who's the partner that can provide all these things, then so that to benefit the partner, the patient. That's all. This is extra work for our end to make sure we have this lineup for them. Yeah.
Another thing, regarding about branding and marketing, or Tzu Chi, there's community health center or community mobile clinic or whatever. How do you promoting, to the local area? How do they know, that what they will have a mobile clinic? People will come. How do you, inform them ahead of the game?
It's all come down to network patients and volunteer, because when early days, even Fresno do not have a mobile at that time. We do a lot of outreaches, and we do 18 times, I think, minimum of outreach a month, every month, and some are twice a month, then plus every week clinic. Then also through that, the message will deliver to like the social services. Fresno County will hear about it, then they come to us, say what you guys offer. They want to know the unemployment benefit. Also come to us and say what you guys do. So we explain to them already. When those clients they need service right away. They say, okay, they print out their flyer from our website and give it to them. Say, here's this guy located at what location. You go see them. That's how we do when in early days, which I think most of our audience are in that stage right now, because that you guys don't have mobile. So you need to build up the relationship with the health department, county, social service department, all those things. They know from the words of mouth, people start know what we can do. Like for example, Seed to Success is a vision program that they approach us to be part of their program initiative in Fresno County. That's why end up we choose the name Seed to Success. Before that, we really planned to have the vision clinic, but we still haven't find the niche yet until this children movement heard about us. When some other partners tell them, why you guys create a wheel when you guys can go look for Tzu Chi? They come and approach us. That's how we join venture and end up with they fully support with grant money, everything to support this program. And we have Fresno County at 30 school district. 18 school district is under this program and is calculated to 70% of the school is in this program. So it's all come to network and talk to people, and people know who you are. That's why I say before people know who we are, we need to do our job to present to people who we are. We are professionally managed outreach. We are very Tzu Chi humanistic side of it. So people have confidence of us to do it. Yeah.
My last question, how do you recruit the volunteer doctor and then volunteer, non-professional people to do all these, like charity, mobile clinic job or outreach? How do you recruit to get like more and more, expanding your TIMA, outreach business?
On recruiting provider is through words of mouth among their provider. And like I mentioned before, you need to inspire our doctors to continue come. Once they come, they really know this is the home for them to do good deed. So our part as non-professional like myself, I need to prepare the platform for professionals to enjoy every time they come and work, volunteer in Tzu Chi, leave the end of the day with happy feeling. That's how we make sure this criteria included our volunteer, non-professional and professional. That's why I can't emphasize, make sure we inspire them. By inspiring them, you have long run. All our doctors some of the doctors they see just on sharing at least 5 to 10 years with us already. And Fresno TIMA doctors, we only have 3 doctors speak Chinese. The rest of our doctors are non-speaking Chinese, and they are Americans. Okay, so
okay.
Thank you.
Thank you, Stephen. Excellent presentation. Thank you so much.
You. And I think my time is up already. We're ready for lunch now. Thank you.
Thank you.